In Africa, as I said, especially East and Southern Africa, again, 54% of the burden in our region. But not only that, we also have very good progress that we are proud of. And we have few countries that have been able to achieve the 95 targets. Eswatini, Botswana, Rwanda, Zambia, Zimbabwe, just to mention few. And other countries like Kenya, Namibia, South Africa, and others are also very close to achieving the global target. Others have different ranges, and what this is telling us is that when there is that political commitment, when we are putting communities at the center, right, that they can play their role, and when we put investment, because the AIDS response in our region or globally is highly dependent on external financing, that is donors, thanks to PEPFAR and Global Fund, who are the main financiers of the AIDS response in Kenya and in many of the African countries. But countries have started to put in domestic resources, right, using data and evidence where they should prioritize investment to make impact. So I think all these factors play a role for those countries who have been able to achieve the 95, but also closing the gap in terms of the new infection. As I said, we in Kenya are also close to that, but given the high rate of teenage pregnancy that we are seeing among our adolescent girls, also the sexual gender-based violence, I think those are some of the factors that we need to focus on so that we can indeed close the gap in terms of the new infection that is happening. In terms of challenge, there are a number of challenges. In some countries, we have criminalization of key population, for example, and that will impede the access to services because they cannot easily come out to access services. That is very critical. Age of consent, for example, among adolescent girls, in order to access, unless they go with parent or with a custodian, they might not be allowed to access to sexual reproductive health, HIV testing. But this is changing, but these have been some of the factors that have affected the slow progress, but also the financing. So it's very important, especially for Kenya, as Kenya is transitioning into a middle income country, to really put in domestic resources. And I'm happy to say that just last week in Kericho, during the Mashujaa Day, His Excellency the President has assented 4 bills into law. And what that means is that Kenyans will have access to universal health care, because they have introduced the primary health care. They have launched the 100,000 community health promoters, and also the emergency and chronic illness fund. And so quite a number of pillars that will enable the effective implementation of the universal health coverage. So I'm hoping that HIV will also be part of all this initiative, so that the gains that have been made so far will be sustained moving forward. And these are some critical inputs that will be required in order to achieve the targets that we have set globally and at country level.